Hi, I'm Tuminello, Director of the McNeese Autism Program, an ABA service provider and graduate-level training facility located on the campus of McNeese State University in Lake Charles, Louisiana.
Hi, I'm Kaycie Stacy, a staff behavior analyst here at the McNeese Autism Program. One of the many things we have to offer is a great staff. All of our staff are master's degree candidates in the McNeese Psychology Program. We are very proud of the extensive educational training our staff receives before they even come through our doors. All of the staff training is done by board-certified behavior analysts.
The McNeese Autism Program is more than just autism. We work with patients from preschool age to adults with autism spectrum disorder, severe behavior problems, and other learning and developmental delays.
Hi, I'm Lettie Alexander, Graduate Assistant at the McNeese Autism Program. I'm proud to be part of our nationally accredited graduate training program in applied behavior analysis. The content of our graduate courses is directly applicable to our day-to-day interactions with clients. All student personnel receive intensive weekly supervision.
In addition to our daily therapeutic services, we offer complete diagnostic assessments as well as IQ testing. However, diagnosis is not required for services. The McNeese Autism Program is also proud to offer assistance to families experiencing health and behavior complications due to medical issues other than autism spectrum disorder. Therapeutic services are available for feeding difficulties, nutritional issues, medical regimen compliance, as well as hygiene, self-care, and self-help skill training. Here at the McNeese Autism Program, we will work with all of our families to develop a specialized program to meet their needs.
My name is Todd Furman. I have an amazing and beautiful wife named Andrea and 3 children, Madeline, 10, Reese, 8, and Vivian, 4 years old. Reese, our son, has autism spectrum disorder, and once upon a time, that meant that we were not sure whether or not he'd ever learn to count to 10, learn his ABCs, learn to read and write, be self-sufficient. We also had to worry when we went out in public whether or not he might wander off and not respond to his name, not be aware of dangers like traffic. But then we started working at the McNeese Autism Center, and that meant hope, because right away we started to see improvements across the board. Today, Reese is in a regular first grade class, working under his own power, and we expect that he's going to be self-sufficient, graduate high school, go to college, hold a job, perhaps get married.
Hi, I'm Annette, and I'm Melania's grandmother. And Melania is receiving services at the McNeese Autism Program. And Melania has a brain tumor, and she also has a severe aversion to food. When Melania was between 4 and 6 months old, Melania was not gaining any weight. She stayed at 10 pounds, 8 ounces. And while we were at the occupational therapist, we noticed that Melania did not want to put a spoon in her mouth. She did not want any food in her mouth at all. And when you did put anything in her mouth, she was in such distress that she would literally spit the food out. So then we started taking Melania here at McNeese, and it's like night and day. In the beginning, yeah, it was a little stressful, but you could put a spoon to her mouth, and she let you do that. And then eventually she started drinking, and then eventually she started eating. And it was a long process, but it was worth it because now she's eating. It's amazing.